Passing AMC exam while pursuing other courses in Australia. Meet Dr. Anushta Chandra, who had cleared her AMC Part 1 with Academically in 2024 while pursuing her MPH degree from Australia, and she's recently cleared her clinical exams. Let's come and meet her, let's watch her journey throughout, and let's see what she has to share about her journey of passing the AMC clinicals as well as the AMC Part 1 examination.
Good morning, everyone. I'm Dr. Snigdha Sharma, Academic Head for Medical Courses at Academically. Dr. Anushta is here with us today. The last I remember, I talked to her back in 2024 October, if I'm not wrong, Dr. Anushta?
Yeah.
Right? She was in Australia. She was very happy and had just qualified AMC 1. And we had a very one-on-one interview session. You can still go watch it on YouTube. And we had talked about her AMC 1 journey and the special journey that she has, which is different from a lot of students who take that journey. And today I have her with us because she has completed the full circle with the completion of AMC Clinical Examination. So before I start, congratulations, Dr. Anushta, on qualifying your AMC Clinical Examination.
Thank you, Snigdha.
So how has this journey been? And especially now, you please tell other people the special courses that you did and the special extra things that you have done to build up your CV, because that's a very common question.
So post MCQ, the first thing I did was go back to India and I got some experience because clinical needs you to be a doctor. I mean, you have to work to understand what you're doing with the patient, what you're supposed to do. So I did that first things first. Then I came back. I got some experience in Australia as well. I did a program called the IMG Clinical Readiness program, which is offered to IMGs to help understand the Australian healthcare system. And also apart from that, to build my CV, I did a lot of other courses such as the BLS, ACLS, the PALS. So all the courses that you require on a daily basis, working in emergency or other departments. So I did that, and yeah.
I've also seen that you have done a lot of observerships.
Yeah.
So that is one question that comes quite frequently, how to get hold of observerships. What advice do you have for students?
With the observership, it's not a clinical experience, but you get to understand how people are working in Australia. I mean, how things go around, how the allied health participates in everything. So I used to approach the doctors of particular clinics or through contacts. I would reach them through mail, and I would just ask for like if they have any slots available or if they are willing to, help me out in this journey somehow. And I would just it would not involve me like putting in any of my ideas into their work. I would just observe, I would just learn. And you have to just reach out to anybody and everybody through mails. And if people are willing, they will like help you. People in the medical fraternity are pretty helpful.
True. So, Anushta, last we talked in 2024, you were about to finish your MPH, you were onshore, and that kind of helped you get these observerships. But post that, how did you manage?
So, I wouldn't say my MPH helped me a lot in getting the observership.
Okay.
So, you can say that I had the benefit of having a work visa in Australia. But again, you can do these observerships even in India if you're not getting a clinical work. But it's always better to work clinically rather than an observership. And also, I've heard that people can come here on visitor visa and do certain observerships. There are certain paid observerships which are run by universities. I've heard of Monash University. I've heard of La Trobe. But it can be quite expensive, but they do give you an observership and you can come here on visitor visa and then do that.
Okay. That is a very helpful information, especially for students. Suppose you're flying for your clinicals, you can do an observership before your clinicals and just get that on-hands experience, and especially getting to know the system before you go in for the clinical examination. I think that is a very good technique. So now while we were talking, you mentioned about a course that's specifically for IMG to understand. Can you explain more about that course?
Sorry, I didn't catch that.
You talked about a course for IMGs to get them used to their medical system that you did when you were in Australia. Can you tell us more about that course?
Oh, okay. You mean the IMG Clinical Readiness program? So it is conducted by the NSW Health. They do it year round. Every year around October, they release the dates. And so you need to have at least a working visa or a PR or a citizenship to be considered for this. And should have cleared part 1 of the AMC exam and also have some little bit of experience as a doctor in your country or in their country. I mean, it does not matter, even if you don't have an experience. And they usually conduct interviews around December every year, and they start in March and run through March to May. So it is a 3-month, like an internship. You get to work with Australian doctors and Australian hospitals. And yeah, you can prefer whichever hospital you want. So it's usually the criteria is that you need to have some rights, working rights in Australia.
So students who are going on visitor visa to attempt their clinical, they cannot?
No.
Okay. So that will be a big no for them. Okay. Now, one common question that we get from a lot of students, they go for clinical and they get stuck understanding the accent. Like Australian accent is we are used to listening to American accent.
Yeah.
That is a very weird question to be asking when you're talking about academics, but what tips do you have for them to work around this accent issue?
So they do really have a thick accent, I'd say. But again, I used to listen to music. So Australian music, there are some like pretty famous bands. I'm not really sure of the name right now, but I used to listen to Australian music. That would help me catch some words. And more than that, I would say the benefit I had was I worked in the hospital in Australia and at Auburn Hospital. So I was talking to patients on a daily basis. I was talking to people. So yeah, you catch on to it in some time. And plus, they have their own abbreviations to everything. So that's there. But in the exam, they make sure that the people giving the exam are pretty comfortable in understanding what the role players are saying. So they won't be mumbling the words or saying it in their mouth. So it is very coherent and clear, usually.
Okay. So sometimes it's not just about being coherent, but we are so not used to listening to someone with an accent. And if you just land up in Australia like a week before, we're already in a culture shock and a new country and everything, traveling for the first time alone. So, okay. Thank you, Anushta.
I mean, if you listen to music, watch movies, of course. That's how we usually catch on to English, right? By watching movies, by watching documentaries. So Australia has really good documentaries and movies. So you should definitely go watch that.
Thank you for that great advice, Anushta. On that note, we'll stop this interview. And congratulations once again.
Thank you.